Hello, and thank you for joining us today for this OncLive peer exchange panel discussion on the management of chemotherapy-induced nausea and vomiting, or CINV. Nausea and vomiting are common in cancer patients, particularly for those receiving emetogenic therapies. In this OncLive peer exchange, a panel of experts in oncology will discuss how to optimally manage CINV in your practice while focusing on the use of new agents and individualized approaches. I am Dr. Lee Schwartzberg, Executive Director of the West Cancer Center, Professor of Medicine and Chief of the Division of Hematology Oncology at the University of Tennessee Health Science Center. Joining me today are Rebecca Clark-Snow, an Oncology Clinical Nurse Coordinator at the University of Kansas Cancer Center in Westwood, Kansas. Dr. Charles Loprinzi, Regis Professor of Breast Cancer Research at the Mayo Clinic in Rochester, Minnesota. Dr. James Natale, an adjunct instructor and clinical pharmacy specialist at UPMC Cancer Center in Pittsburgh, Pennsylvania. And Dr. Eric Roeland, Assistant Clinical Professor at the University of California, San Diego in La Jolla, California. Thank you all so much for joining us. Let's begin. So we're going to start with a very fundamental but important question. Why is treating CINV important? Charles, would you lead us off?
Be happy to. Chemotherapy-induced nausea and vomiting was the biggest fear related to chemotherapy 10, 20 years ago when we didn't have much in terms of antiemetic therapy. Nowadays, nausea is the biggest problem, and vomiting is less of a problem because we have much more effective antiemetic medications that we're going to talk about now. So it's still perceived as a big problem by many patients who are about to receive chemotherapy. And oncologists, other doctors realize this, ER doctors realize this at times when patients have to be hospitalized because of nausea and vomiting problems.
Yeah, I'd add that patients, it's their number one thing they're worried about. I mean, losing their hair and having nausea and vomiting. And I think the media really continues to push that agenda and support that that's typical with chemotherapy, and it doesn't need to be that way. And lastly, I'd add that oncologists might think that this is actually solved. Many times, oncologists are not the ones getting the phone calls regarding these issues, and so they think that chemotherapy-induced nausea and vomiting is no longer an issue. But patients and loved ones would highly disagree.
So I'm hearing that there may be a disparate view between practitioners and what patients are really feeling.
Yeah, I think it just highlights the complexity of cancer care now and everything that's going on, and the important role of having a team to approach these symptoms.
I would agree with you, Eric. And the other piece of information which we know is that certainly the better job we do treating with first cycle or second cycle chemotherapy, we do a better job with subsequent cycles of chemotherapy. So it's really important that we kind of start off on the right foot and control nausea and vomiting from the outset so that we can prevent problems later down the line of therapy.
Rebecca, you're close to patients, and you're hearing more than probably the oncologist. What's
Actually,
you hear?
And thank you. I think it's really important that we all approach this as a multidisciplinary approach with physicians and nurses and pharmacists. But, primarily it's the nurses who are the ones who are in contact with the patients most often. We hear patients who have, at some point in time, heard a horror story from a relative or a loved one. And it's up to us to sort of bring them back and really give them the bare bone truth and facts about what to expect and the good things that have been done and how we're going to treat them and prevent nausea and vomiting.
And prevention is really the key, and we should really focus on that in order to do well down the stream, as you mentioned, we've got to start with adequate prophylaxis.
Yeah, Leah, the only thing I'd add to that is that patients oftentimes just don't tell us, because I have patients that actually think if they're nauseous, that means their chemotherapy is working. Mm-hmm. And so there's this fear of telling your oncologist that you're having these symptoms because you're going to reduce the dose or delay the treatment. And so it's not only just empowering clinicians to ask about this important symptom, but it's also letting patients and loved ones know that they need to tell us, and that doesn't necessarily mean we'll be less aggressive.
Yeah, there's a lot of fear. What do your breast cancer patients tell you about this? Do they minimize it?
If they see me, they never have any nausea, vomiting. No, I think they do to some degree, and also data in the past. Steve Grunberg was involved with this, I think, with trial with actually asked patients what their nausea and vomiting was, and asked the nurse and doctors. And we were not too bad in terms of the acute, but for the delayed, we were way off. The patients had a lot more. Part of that is patient recording, and nowadays the new thing is PROs, patient-reported outcomes, and having patients write it down, as opposed to trying to remember it and telling the doctor 2 weeks later when they come back there are other things that have happened and it's not on their mind as much and that sort of thing. So understanding it from that standpoint. Rebecca, you know this too better. There are phone apps you can use that actually can, whether you need to know exactly that I have 10%, 20% nausea, this sort of thing, you need to get the flavor of it. And I think we do get a pretty good flavor for it from our patients.
Well, more importantly, I think, it's getting in touch with patients after treatment. I mean, nurses are very busy, so not everyone can certainly get in touch with patients and call them in the following days, but to at least pick up the phone and make a quick 5-minute phone call just to check in and see how they're doing can make all the difference.
So we're hearing out of sight, out of mind. We don't really know what's going on
Right.
after they leave the infusion center. And we've
Exactly.
done a good job in acute nausea and vomiting with the drugs that we have now, but we still have problems with delayed nausea and vomiting.
Yeah,
And
or
we need
even-
ways to communicate.
Even if patients can't phone in, have a loved one or someone who's in that household give us a call and let us know just how things are going.
They often wait till Friday afternoon.
Yeah,
right,
they
and get
do, I
nervous.
know.
Yeah, yeah.